Good evening, everyone. My name is Priyanka, and I'm the Allied Health Integration Program Officer here at CESPN, and I'd like to welcome you to our Digital Health Update session for Allied Health. Also joining us today from the PHN is Grace, who is the Digital Health and Quality Improvement Officer, and we have Lauren from the CPD team as well. So I would like to start by acknowledging the Aboriginal owners of the land, the traditional custodians, and the sovereign people of the land across which we work. I recognize their continued connection with land, water, and community, and pay my respects to elders past, present, and emerging. I would also like to extend that respect to any Aboriginal colleagues joining us today. So just a bit of housekeeping before we get started. So we're going to use the chat function to ask any questions. And also this webinar will be recorded and an evaluation survey link will pop up on your screens at the end of the session. Here are some upcoming events. And if you'd like to register for any of these, you can find these on the CESPN website. We also have a cultural awareness training on 18th of June and one on the 19th of November. CESPN also provides support to Allied Health when it comes to accreditation, registering for My Health Record, Provider Connect Australia, and Provider Connect Australia. We also have 5 urgent care clinics within our catchment. So the urgent care services are provided short-term, one-off care for one-health care for health needs that are not life-threatening. So the urgent services are free for the Medicare card holders and for the community-based asylum seekers. We also have the Medicare mental health centers within our region. So now we get to the learning outcomes. So today we have an exciting agenda lined up, focusing on the key learning outcomes. So we'll start with PRODA and how the provider digital access system plays a critical role in streamlining secure online interaction with Medicare Australia. We'll walk through how to register for PRODA and how it opens the door to access tools like My Health Record. Followed by an overview of My Health Record and how it can be accessed using the National Provider Portal, which is a web-based platform, and the Allied Health don't need a conformant software for that. We'll also go through Provider Connect Australia, and towards the end of the session, we'll introduce electronic prescriptions and the active script list. And we'll also briefly introduce the My Health app. So now I'll hand it over to Grace, who will give us a brief introduction of PRODA and HPOS.
Thank you, Priya. Could I get perfect. So PRODA is basically the place where, or the key that allows you to access a lot of different types of government healthcare programs. It stands for Provider Digital Access, and some of the main things that a healthcare provider can do using their PRODA is access HPOS, which is Health Professionals Online Services, My Health Record, and the NDIS. So all of that is done using your PRODA. So it's quite helpful to have one. So you can apply for a PRODA online. These are the steps that you follow to do them. If you have any problems or questions, you can always reach out to us. So create your account, verify your identity. Obviously, this needs to be done to make sure that you are the provider that you say that you are. Can I get the next slide? Yeah. So HPOS is the HPOS is the area where a lot of these services sit that Medicare or the government has created. So it allows people who have a PRODA to interact with government services in a much more easy way. No forms, it's all done online. It's really, really helpful. So you can do things like check eligibility. You can look up a patient's Medicare card if you have their permission to. You can make claims, you can generate reports, and you can update your personal details. So you can change your address, you can change your bank details, stuff like that. one of the most helpful features of having a PRODA and using HPOS is that you can also apply for provider numbers almost instantly. Sorry. So it's a lot less hassle than having to fill out a form and wait. Next one. Yeah, so this is just an overview of some of the services that you can access using HPOS. You can do online claiming there. You can apply for an initial or a follow-up prescriber number, provider or prescriber number. You can administer delegates. So if you are the head of an organization and you have, say, a practice manager that you want to act on your behalf in terms of making claims or looking up patients' eligibility for item numbers, you can delegate, you can set that person to be your delegate, and that way they don't have to keep bothering you, asking you for permission or for an SMS verification code. You can update your banking. You can view details about your provider number. So if you're having any issues, you'll be able to go into your inbox that has sent correspondence letting you know what the issue might be and how to fix it. You can access track and scale information. You can access patient information, and you can also obviously look up eligibility for MBS item numbers, which is pretty helpful if you don't know if the patient has already accessed, say, all 5 of their teen care arrangement sessions already for that year. Okay, next slide. Cool. So to get a provider number on PRODA, it's actually very, very easy. You log in, go to HPOS, so navigate to HPOS on the services page. You'll go to your details or my details, and then next slide, thanks. Go to provider numbers, and then you just create a new provider location. It's really, really simple. Once you've done that, it'll take you to the next page where if it's happy with the address that you've popped in, you'll put the contact organization and banking details in, and then it should be, sorry, next slide.
Yeah.
Oh,
it should be
pretty instantaneous. Yes. So it happens really, really quickly. It's delivered like on the screen. You don't need to wait for another email or anything. It's really, really helpful. So
I'll take over. Yeah. Thank you, Grace. So now we'll go to how to use the MBS item online checker on HPOS. So you can use this checker to view and check the patient eligibility for a specific item number based on their MBS history, or check your own eligibility as a provider for claiming or billing the services. So I have listed all the steps on the right-hand side of the slide, but we'll go through the screenshots just to make it a bit easier. So for this, first thing you need to do is to log into your PRODA account. So once you're in your PRODA account, you'll see the HPOS tile under your My Linked Services. So once you're there, you'll just click the Go to Service on HPOS. Once you click that, this window is going to pop up, which says Items. Once you're here, just click on Items, and then you can see the MBS Online Checker there. So once you're there, click on the MBS Online Checker, and then this screen is going to pop up, which is going to ask you for your patient details. So the patient details that you'll need is going to be the Medicare card number, the patient's individual reference number, and their first name. Then you can just scroll down and put your provider number and the location. Once you're there, just scroll down again and then just put in the item number that you want to check. You can also filter these item numbers based on the care plans. Then you can just hit the check items under the bar, and then you'll see the search result coming up that if you can claim the item or not. It's pretty easy and simple. And if you want to do another check, you could just click on the new check under, in the bottom of the screen. So now we'll go through what My Health Record is. So My Health Record is a secure online summary of an individual's key health information. An important element of the system is that it's personally controlled. That means a patient has a say onto what gets uploaded on his My Health Record, who gets to view it, and what stays on their record. It also forms a part of a national system. That means the patient's My Health record travels with them wherever they go, no matter which healthcare provider they're seeing. So to understand how the My Health record system works, we need to understand what the 3 health identifiers are. So the first one is the IHI, which stands for the Individual Health Identifier. So it's a unique 16-digit number that every person with a Medicare card gets, and it indicates who receives the care. And then the second one is a HPII, which is the healthcare provider identifier for an individual. That means the healthcare identifier for the healthcare provider, which indicates who provided the care to the patient. And the last one is the HPIO, which is the health provider identifier for the organization, which indicates where the care was provided. So you'll need all 3 numbers to access someone's My Health record. So there are a lot of relevant documents on My Health record, which could be useful in your role. So these documents can include documents, consumer documents such as personal health summary, personal health notes. Then we have the Medicare documents, which are like the Australian Immunization Register records, and the provider documents, which are uploaded by a person's healthcare provider, which include documents such as the shared health summary, discharge summaries, pathology reports. It also includes the diagnostic imaging, and for pharmacists, it includes the prescription records and the dispense records. So now the question is, how do we access My Health record? So the My Health record can be accessed in 3 ways. So the first one is via conformance software. So the only issue with this right now is the Allied Health, none of the Allied Health software are actually conformant with My Health record. However, there's an industry offer by the Australian Digital Health Agency, and we think that in next few years, we'll have a few of the Allied Health softwares conformant with My Health record. And the second one is the National Provider Portal. So this is what the Allied Health will be using to access My Health record. We just need to note that the National Provider Portal is a view-only platform. That means the Allied Health won't be able to upload any information. However, they can view everything that's on someone's My Health record. And we'll be briefly going through, we'll go through a simulation of how you can use the National Provider Portal in the coming slides. And the last option is the My Health app. So the My Health app is a consumer-facing app. So you can ask your patients if they got the My Health app and view their information on there. So just bear with me for a second. So I'm just gonna share the video of how to use My Health record using the National Provider Portal.
As a healthcare provider, one way you can access and use My Health record is through the National Provider Portal. It is free and allows you to see any of the key health information held in a person's My Health record. The National Provider Portal is a web-based, read-only site for healthcare providers who do not have conformant clinical software that is integrated with My Health record. To access the National Provider Portal, you will need to have a PRODA account. And your healthcare organization will need to be registered to use My Health record. Please refer to the agency's website for information about how to register. Once registered, log into your PRODA account, then select My Health record, which is located under My Linked Services. Select your organization and then enter patient's surname, date of birth, gender, and identifier. Then click Search. The first screen you will see is the Health Record Overview, where you can see any documents uploaded since the last shared health summary. When you scroll down, you will see information from the latest shared health summary, including current and past medical history, medicines and allergies, and adverse reactions. Use the tabs along the top to find other key health information. There are a wide range of documents at your fingertips. Popular tabs are Clinical Documents, Medicines and Conditions, and Medicare Records. Under Clinical Documents, you can find diagnostic imaging reports, pathology reports, and specialist letters, just to name a few. Now let's have a look at how simple it is to access some key health information that may inform your clinical practice. In this example, we will look at a patient's medicines information. To find the medicines information, you can click on the Medicines and Conditions tab or use the shortcut link here. The Medicines Information view will display the Allergies and Adverse Reactions tab by default. Click on the Medicines Preview tab to display the medication summary. Here you can see the patient's medicines and their directions for use. Looking at the medicines preview helps you to understand the patient's medication history. Now let's take a look at how to access and view diagnostic imaging reports. If you wanted to see a patient's diagnostic imaging report, it can be found under the Clinical Documents tab. Click on Diagnostic Imaging Report, then you can either search for the event date or find the relevant report in this area. Double-click to open the report. From here you can see the diagnostic imaging report. You can also save a copy of the report if needed. Have a look at my health record today, your health in your hands.
Okay, so that video showed how you can access My Health Record and what is the information you can view on the National Provider Portal. So we know there are a lot of questions that arise when it comes to the privacy and access control settings in My Health Record. So a patient can choose to restrict specific documents on their My Health Record by something called as using like a limited document access code, or they can choose to restrict the entire record by using a record access code. They're also able to remove any document at any time, and they can be alerted when a healthcare provider views their My Health Record, which means that the My Health Record is monitored at all instances. As a healthcare provider, it's important to note that you can override these functions by something called as emergency access provision. It's also referred to as the glass break function, but this function can only be used if a healthcare provider believes there is a threat to the public health safety or to the health of the patient, or it's unreasonable or impractical to obtain the consent of a patient. So now I'll hand it over to Grace, who will briefly go through the My Health app. Sorry, Grace, I can't hear you.
Is that better?
Yeah.
Sorry.
Now. Yeah,
Cool.
that's all good.
So the agency has developed the My Health app. It's designed to encourage consumers to easily access their health information in My Health Record on their mobile device. The app had a soft launch last year. It's free and available to download via the App Store and the Google Play Store. It allows users to view their information, download documents from their My Health Record onto their mobile device, and even share documents that contain their health information with other people and organizations. So if your organization isn't yet connected to the My Health Record, your patient may be able to use the information on their My Health app and show you a list of their medications or the summaries or the test results that they have, or even their imaging on the app. And they could even download it and then email it to you if they wanted to. So it's a pretty useful tool for patients and also for allied health professionals. So this is a snapshot of the app's home screen, which lets consumers access information and documents, including those that consumers, their representatives, and healthcare providers like yourself have uploaded to the My Health Record. The three sources of information or documents that can be accessed are clinical documents, personally entered information by the consumer, and Medicare information.
Okay, so now we'll go to Provider Connect Australia. So as we look into the allied health sector, it's important to note that a large proportion of the practitioners operate as sole traders or operate within small practices. So they often stretch between juggling the clinical responsibilities and the day-to-day running of the business. And that brings us to the challenge for a lot of allied health practitioners, the process of registering with various business partners and keeping the information up to date can become a significant admin burden. So for that, the agency has developed a tool called Provider Connect Australia, or PCA. So it's a newly introduced system. It's a no-cost service operated by the Australian Digital Health Agency, and it focuses on streamlining the maintenance of healthcare organization and their practitioners' information. So I'll hand it over to Grace.
Yeah, so the PCA, it facilitates the accurate updating of business information. So it allows you to update all of your information about your business in one source. It's a single source of truth. It distributes the updated information to business partners. And these business partners can include nominated hospitals, pathology and radiology services, public service directories, secure messaging providers, and more. Yeah, so the benefits of this, it streamlines communication and information sharing among healthcare providers. You don't need to be updating multiple databases whenever someone starts or leaves a practice or a location. Reduces transcription errors, eliminates the hassle of filling out multiple forms, and promotes accuracy, reduces administrative burden, enhances collaboration among healthcare providers and partners. So it's just, keeping everyone connected, keeping the information nice and accurate.
Okay, so the information that you can publish on Provider Connect Australia is like if a new practitioner is joining your practice or someone is leaving, you can update your organization's contact details or the location where the care is provided. You can even put in like any new services or discounts that you're offering, change your operating hours. And the most important feature is that you can choose to publish it to either to your partners or to your consumers or to both. Okay, so now so this slide is specifically for the pharmacists who may be in the crowd. So just a brief overview of the electronic prescriptions and the active script list. So the electronic prescription, also known as e-scripts, are the digital version of the paper prescriptions. So these are just a safe and a convenient alternative to a common paper prescription. And the patient can choose to receive an e-script on their phone, or like as an SMS or as an email, or have any of their medication added to their active script list. So for the patients with chronic conditions, taking a lot of medications, it's going to be hard to juggle with all the paper prescriptions they have. So they can have an e-prescription, an e-script, and add it to their active script list. So active script list is a secure, consolidated list of all the patients' active electronic prescriptions. So it just makes it easier to manage and access multiple medications. So now, so this was the end of the slides, and we do have some resources. So for National Provider Portal, so we have this course that's offered by the Australian Digital Health Agency. So it goes through like how you can connect to My Health Record, how you can register your organization, and it has a case study on allied health in there as well. And the video we just showed you, that's on there as well. So you can use that as a guide if you want to set up My Health Record in your organization. And if you want to connect to Provider Connect Australia, we have some resources here. So just for the My Health Record, so before you get My Health Record and your organization starts using My Health Record, you do need to have a My Health Record security policy in place. So just in case, like none of the admin staff are like randomly accessing the patient information. So we do need that policy in place. Okay, so that brings us to the end of the session. So we do understand it was quite an extensive session with a lot of topics. So if you guys have any questions, please feel free to pop them in the chat box. I'll give you guys a minute if you guys have any questions. Grace, are you able to see if there are any questions in the chat?
None yet.
Yeah. Even if you have questions after the session on how to register for My Health Record, just feel free to contact us. We'll have our emails and phone numbers on the slide. So just give us a call or send us an email and we can help your organization set up with either if it's Provider Connect Australia or My Health Record, or if you need any training with PRODA or how to use, how to access the MBS online checker or how to get a new provider number, just feel free to reach out. I'll just give you guys another minute just in case any questions pop up. No questions? That's all good. So we have the contact details on the screen. So if you have any questions after the session, please feel free to send us an email. Otherwise, thank you all for joining us today.
Oh, we just got a question.
You did?
Yeah, what kind of providers are already putting info into the My Health Record?
So currently, 99% of the general practitioners are using My Health Record. It's a part of their EPIP incentive. They upload shared health summaries. We have pharmacists that are uploading dispense records. And then we have residential aged care facilities uploading all the information. We have registered nurses uploading the event summaries. The intake for allied health is a bit low because there's not a conformance software, so that's the only issue. However, nurses, general practitioners, specialists are all uploading information on My Health Record right now. Any other question, Grace?
Nope. They said thank you. You're welcome.
Awesome. Okay. Okay, all good. Thank you. Thank you all for joining the session today. And thanks, Grace and Lauren, for helping me
Thank
out
you.
with this. Have a good night, guys. We'll talk soon.
Thank you so
Thank
much.
you.
Bye,
See ya.
everyone.
Bye.